We know people who are sick can breathe out or cough out or sneeze out viruses, and that can transmit from them to another person. The risk would be highest if you're in close proximity face to face, but also if you're in close proximity in general, there could be a risk of inhaling some of those infectious particles. If you're at longer range, probably the risk is quite low though. These particles probably don't go a long way. There's probably not that many infectious particles being breathed or coughed or sneezed out by an infected person. Also, some of those particles could land in the environment, or an infected person could contaminate their hands, maybe by touching their nose or their mouth, and those contaminated hands could then contaminate the environment around them. So maybe you could get on the bus and touch a handrail which has got virus on it and then infect yourself that way. And that's why hand hygiene is so important. When we talk about source control, we mean the use of a mask by someone who's infected to catch the virus before it gets out into the environment. So by wearing the mask, you catch the virus in the mask and it doesn't go into the environment and then infect other people. When we talk about using masks for protection, it's the idea that if you're not infected, you can wear the mask so that you don't either breathe in the virus or touch your nose or your mouth with your hand that might be contaminated with virus on it. So that's two different reasons for wearing a mask. We just published a study on the topic of using masks as a source control. We collected data between 2013 and 2016 in patients who had either flu or a common cold infection, including seasonal coronavirus infection. We used a special device that could capture all of the air that they breathed out or coughed out, and some of the patients wore masks, others didn't. What we found was a lot of virus in the exhaled breath for influenza, for coronavirus, and also for other common cold viruses. We found that the face masks were very good in stopping the virus from getting out into the environment. They reduced the amount of virus that got out a lot in those patients with influenza and also with seasonal coronavirus. But that's a really important finding. It shows that masks do work as a source control, and if people wear them, if they're infected, maybe even if they don't know they're infected, if they're wearing a mask, it would help to reduce spread into the community.